In this video, we're going to be going over the peripheral and central chemoreceptor functions. Remember, peripheral chemoreceptors consist of the carotid bodies and the aortic bodies, and they're going to send this information into the medulla oblongata, whereas your central chemoreceptors are actually in the medulla oblongata itself. To understand how this happens, we have to talk about the partial pressure of gases. So for example, when you're looking at this right here, that's showing PCO2. Well, what is this P in PCO2? And we're also going to see this in PO2 and PN2. And so we're talking about gases within the body. We use PCO2 or PO2 or PN2. And the P stands for partial pressure. So what is partial pressure? That's what we're going to look at next. When we're looking at pressure of gases, we have atmospheric pressure. And at sea level, the atmosphere pushes down on us like the water would if you were at the bottom of the ocean. Even though you don't feel it, because your body also has gases inside that are pushing out, your body is being pressed on by about 14.7 pounds per square inch, or 760 millimeters of mercury of pressure. Every square inch of your body at sea level has all of these gases that are pushing down on you with that amount of pressure. But you don't feel this because you also have gases inside of you that are pushing back with the same amount of pressure. On average, a column of air that's 1 square centimeter in cross section or 1 square inch in cross section, depending on the source, measured from sea level to the top of the atmosphere, would have a weight of about 14.7 pounds per square inch. Atmospheric pressure is also called barometric pressure. What's going to happen with a barometer is that the atmosphere pushes down on the mercury here, which pushes up on the column, which is 760 millimeters of mercury high, which is 76 centimeters high. That's showing how much pressure the atmosphere is pushing down to push the column of mercury up. And when we have changes in atmospheric pressure measured with a barometer, let's say low atmospheric pressure, well, this column of mercury is going to set lower. And if we have higher atmospheric pressure, the atmosphere is going to push down on this and push this up higher into this column. So that's what we mean by barometric pressure. Well, scientists by the name of Dalton looked at the total pressure of a gas mixture and said, okay, well, how much will each of the gases that are in this mixture contribute to the total? And he came out with what we call Dalton's law, which says that the total pressure of the gas mixture is the sum of all the pressures that each gas in the mixture would exert independently. And we refer to the pressure of that particular gas in the mixture as its partial pressure. For example, if we look at atmospheric pressure, which is 760 millimeters of mercury of pressure, how much does the nitrogen contribute to this? About 79% of the atmosphere is made up of nitrogen. And so 79% of 760 winds up being 600 millimeters of mercury of pressure. So that's its partial pressure of nitrogen. The partial pressure of nitrogen is how much pressure nitrogen exerts in the total pressure of the gases. Shown here is an example on how to figure this out. For example, oxygen constitutes 21% of the atmosphere. So its partial pressure is 21% of 760 millimeters of mercury, or about 159 millimeters of mercury. Well, nitrogen and oxygen account for 99% of the total atmospheric pressure, so these two gases are going to exert the most of all other gases in the atmosphere. Well, the nervous system is going to adjust the rate of ventilation to maintain the arterial blood pressure and carbon dioxide pressure at relatively constant levels. So whenever we refer to a particular amount of gas in the body, we always refer to it as its partial pressure within the body. How much oxygen we have? Well, it's the partial pressure of oxygen that's going to refer to that. When we look at the effects of blood PCO2 and pH on ventilation, remember, blood PCO2 and pH have more of an effect on the ventilation rate than PO2 due to the large amounts of oxygen stored in the hemoglobin. And oxygen is not going to have an effect unless it gets really low for those chemoreceptors to pick that up, and then that becomes a driving force for breathing. You want to make sure you star this. Blood, carbon dioxide, and pH are going to have more of an effect on ventilation than O2 under normal conditions. Well, the chemoreceptor input to the brainstem is going to modify this rate and depth of breathing so that arterial PCO2, pH, and PO2 remain relatively constant. Well, how does a body do this? Well, we have our peripheral chemoreceptors and we have central chemoreceptors. When looking at the peripheral chemoreceptors, we have aortic bodies that are located here in the aortic arch, and these are right next to the aortic sinuses, which are your baroreceptors. And you also have the carotid bodies, which are right next to the carotid sinuses, which are your baroreceptors. But the carotid bodies and aortic bodies, these are chemoreceptors. They're going to detect the amounts of PCO2, pH, and PO2 concentrations in the blood, and then they're going to send it via neural impulses to the medulla oblongata. Increased PCO2, which is also called hypercapnia, this is going to occur during hypoventilation or exercise, increased activity, which is going to cause a rise in carbonic acid and a decrease in pH. This is going to result in an increase in breathing rate. Now remember when we were talking about water reacting with carbon dioxide, that's going to give you carbonic acid. So the more CO2 you have, the more carbonic acid you're going to have. And we have an enzyme, remember that carbonic anhydrase, that's going to contribute to the conversion of CO2 and water to carbonic acid. We covered that in the blood, and we're going to see that same thing happening here. That carbonic acid is going to dissociate into hydrogen ions of bicarbonate, and those hydrogen ions can affect your pH, can affect your breathing rate. Well, you also want to note that these bodies are not stimulated directly by carbon dioxide. They're stimulated by hydrogen ion concentration, or the pH. So even though we talk about PCO2 having its effect, it's having its effect when it's converted over to hydrogen ions via this carbonic acid pathway. Decreased PCO2, also called hypocapnia, as occurs during hyperventilation, causes an increase in pH due to the decrease in carbonic acid formation, resulting in a decrease in breathing rate. So hypoventilation, as when you're holding your breath, or let's say you have a disorder such as an asthmatic attack or COPD or emphysema, and the person can't get all the carbon dioxide out. They're trapping air. You're going to see an increase in CO2 in their blood, and that's going to cause their pH to go down, become more acidic. If you have somebody who has, let's say, an anxiety attack, and they're breathing really rapidly because of that, well, they're going to get rid of too much CO2, causing less carbon dioxide is going to cause an increase in pH. And once you have these changes occur, of course, this is going to stimulate your medulla oblongata to send impulses to your inspiratory muscles in order to adjust your breathing rate to bring this back to normal. For example, if you are getting too much carbon dioxide built up, then that's going to increase your breathing rate to get rid of CO2. Or if you have a decrease in carbon dioxide because of hyperventilation, then your medulla is going to try and slow down your breathing rate. For example, if you have hyperventilation, let's say you have somebody who's anxious, they start to hyperventilate. What's one of the common things that you can do to help prevent them from passing out? Because as they hyperventilate, you're going to get rid of too much CO2, your pH is going to go higher, you have less hydrogen ions, and that can cause somebody to pass out. So they give them a paper bag, and they rebreathe in some of that carbon dioxide that they're breathing out to help adjust their carbon dioxide levels to bring it back to normal, because you're losing too much CO2. So you're trying to put some more CO2 back in to stop it from getting too far off. You want to use a paper bag on this because oxygen can still get in through that paper bag. You don't want to give them a plastic bag, for example, which can prevent the amount of oxygen from getting into the lungs. Then you have all kinds of other problems. Central chemoreceptors are located within the medulla oblongata. They respond to changes in carbon dioxide level and pH levels in the cerebral spinal fluid. Hydrogen ions cannot cross this blood-brain barrier into the cerebral spinal fluid and then into that medulla oblongata, but carbon dioxide can. So how does the central nervous system monitor pH then if hydrogen ions can't cross the blood-brain barrier? Well, when that carbon dioxide comes into the cerebral spinal fluid, it's going to react with water and be converted over to carbonic acid. That carbonic acid is going to dissociate into bicarbonate and hydrogen ions. These hydrogen ions can go into the medulla oblongata, where you have those central chemoreceptors, and then that can adjust breathing rate based on the hydrogen concentrations. So the lower the pH is going to stimulate these central chemoreceptors to increase ventilation when there's a rise in arteriolar CO2. So we talked about before with the peripheral chemoreceptors. If your carbon dioxide builds up, that's going to stimulate your respiratory center to increase breathing rate to get rid of that CO2. However, the central chemoreceptors can take longer than the peripheral chemoreceptors. In fact, the central response takes several minutes to occur, where the peripheral chemoreceptor response can occur within seconds. The immediate increase in ventilation rate. Let's test our knowledge. Go ahead and pause your video and select the term that makes the sentence correct. Here are the answers. Go ahead and pause your video, select the term that makes the sentence correct. Here are the answers. Pause your video, select the term that makes the sentence correct. Here are the answers. Pause your video, select the term that makes the sentence correct. Here are the answers. And this concludes this video, and let me know if you have any questions.